Hello, my name is Jodi Skulls, and I'm your instructor for the MBLEx review course. Happy to be with you today. Look at our crowd, man. Look at this awesome crowd of people who are about to become licensed massage therapists. So exciting. So exciting. So today we're going to be talking about healthcare terminology. So we will be diving more deeply into how do we interpret. Okay, let's see. Sorry, I got to pause here for a second because got just a couple of microphones still open. Thanks for your patience. Okay. All right. So today we're going to be studying healthcare terminology. We're going to be taking a look at how do you interpret these words. We've got some long words that get thrown at us. And what is the philosophy here? So also you'll notice in the description of this class, there are a couple of links that are quite helpful. There are two lists that go over dozens and dozens of words. One list has 300 words on it. And as I prepared your class for today, I thought, okay, how are we actually going to tackle this? And so the approach you're going to be learning today is how to really dissect a word that you don't know. And so we'll put that into practice in today's class with healthcare terminology. But of course, I do class in 3 parts. The first part is some test taking strategy. The second part is going to be your learning. And then the third part will be dissecting questions. Each one of these sections of class are important simply because learning on its own is not quite enough. You actually need some strategies to take into the testing center, some strategies to keep yourself calm, as well as understanding how to get to the meaning of the questions. So, what are they truly asking? And that's what we do when we dissect questions. So um, we get to the meaning of the question. Once you have the meaning of the question, once you understand the question, it is remarkable. You actually know the answer. It's just understanding the question. And so that's why we dissect questions. So to start with today, uh, what I'm what I wanted to remind you of, the test taking strategy that I want to remind you of is to control what you can control on game day. Game day is the day you take the MBLEx. It's game day. And just like professional athletes prepare for their game day, you get to do the same type of preparation. Now, you may not adjust your eating, you may not adjust your exercise routine, but you are going to control what you can control. And right now, what that is your study time. You can control your study time. What else can you control? You can control what you study. And also on game day, this is very important for game day. You are going to control what you can control on the day you take the MBLEx, on the week you take the MBLEx. So you're getting good sleep the night before. You might be a little nervous. That's okay. We're going to practice this technique to work on our nerves in just a moment. But you're going to get a good night's sleep the night before. You're going to eat what you eat for breakfast. Plan what you're going to eat for breakfast. Don't leave it to, oh my gosh, what do I have in the fridge? Plan if you're going to have coffee or you're going to have tea. Plan your route to the testing center. I recommend you actually drive it the week before or the day before, depending on how far it is. Know how long it's going to take you to get to the testing center. Remember, you have to be at that desk 30 minutes prior to your test. Now, the MBLEx also now allows you 120 days from the time you get your authorization to test. So you actually get a full 4 months from the time you pay your money to actually schedule your appointment and take your test. So you only get 4 months. So make sure that when you got your authorization to test, you know when that expires. Also, if you end up changing your date, it's a $50 fee. So plan accordingly. Control what you can control, right? So even as far back as when you make your authorization to test, you go ahead and pay your money, and then you've got your 4 months. Tick tock, man. Game on. Yeah. Then you know you got to take it sometime within the next 4 months. And that's when you start to corral what you can control. And corralling what you can control simply means, again, the study time, your nutrition. Are you eating brain food? What's brain food for you? Sometimes it's coffee, sometimes it's chocolate. But are you getting some real food? Are you getting some whole food into your system? It can help with your concentration. But more so on game day. Well, I guess not more so, and especially on game day, making sure that you're well versed in how to get to the testing center, what door to go in, where to park, what you're wearing, eating, all of these things I'd like you to take into consideration and not just leave to chance, because you can control what you can control. But then there's some stuff you can't. And those are the times maybe we feel a little flustered. When I took the MBLEx, got the time of the test wrong. They almost didn't let me test because they're like, "You're late." And I'm like, that's not a good way to go into taking a test. But you know what tool I had in my toolbox? I had my breath. And so let's just take a minute before we go into our learning and breathe. I'd like you just now to think about your breath. Are you breathing in through your nose or in through your mouth? Let's switch that over to in through the nose. So let's go in through the nose and out through the mouth. So in, breathing in sunshine, breathing in light, breathing in cool air, breathing out warm air, breathing out heaviness, breathing out mud, breathing out stress, breathing out that which no longer serves us. Breathing in light, breathing in through the nose, love, breathing in acceptance, breathing in self-love, breathing out heaviness, frustration, the busyness of the day. Breathing in light, cool air, and breathing out all that no longer serves us. Do a body check right now. How are you feeling? Hmm. Feeling more grounded? You have that tool now too. The breath, too. Practice using it. Can be very helpful. Ready to go into some learning? All right, this was learning for me too, because healthcare terminology is a new class. Here we are. All right. So, healthcare terminology. There's a lot of it. Um, However, why do we even care about learning healthcare terminology? Well, we do need to prepare for the MBLEx. But this terminology, and I promise you, it's almost like a second language or another language. Many of you already speak a second language, but it's like a lot of these words you're already familiar with, but it is like learning another language. It's the language of science. So to pass your MBLEx, you get to learn science language. It'll enhance the communication that you have with other healthcare professionals. It'll give you a better understanding as well of some conditions. So if you were to see lab reports with healthcare terminology or medical terminology on it, it's another word for this category, medical terminology. It'll help you make more detailed SOAP notes. It'll help you to understand pathologies. It'll help you to understand medications. It'll also give you more professionalism and more confidence, especially if you're having interdisciplinary discussions. What is interdisciplinary? Interdisciplinary, when you're talking with other healthcare providers about the treatment of this client. And of course, we need it for the MBLEx. It'll help. Watch. So I've put together um, the concept of healthcare terminology, and also want to give a great shout out to Rasmussen College. Thank you. I'm using your cheat sheet. There's some good stuff for massage therapists, but this is for medical professionals, and it really helps to understand what we're tackling, how to get your head around healthcare terminology. So take a look at this. This is the basic, just like all of our movement starts from anatomical position. Medical terminology has three categories, three parts of the word. Now, these three parts aren't in every word, but the long ones have them, and that is a prefix, a suffix, and a root. So the root word, you can understand like the roots of a tree, the basics of the word. The root word is going to be a descriptive word. The prefix, pre, is going to come before, and the suffix is going to come at the end. You may have learned this in high school or middle school, the prefix and the suffix. We're coming back to it. All right, let's take a look at this example. This is a very long word that would be very difficult to know what they're talking about. But let's see what we can recognize. So do you see this here, rhino, in the middle? So rhino, related to the nose, right? Rhinoplasty, related to the nose. Rhino. Think of that rhino with the horn, right? Rhino. So this is related to the nose. Where's my cursor? There it is. Larynge. Larynge, related to the larynx, right? Related to the larynx. We're going to learn these. Ology, the study of, like biology, right? And then OTO, O or OTO, often related to the ear. So, what do you think this means? It's an ear, it's the study of the ear, nose, and throat. Now, I have never even heard this. That's probably why they use ear, nose, and throat doctors. But yeah, so otorhinolaryngology. Otorhinolaryngology. Big long word, but now that can you see it? We've got a prefix related to the ear. This is actually all a root word. These are all roots. There's not really a prefix in here. So most medical terms come in just two formats. Yeah. So you're going to have a root with a suffix, or you're going to have a prefix, a root, and a suffix. All of the medical terminology has a root. Some have prefixes. Most have suffixes. All right, let's take a look a little bit closer. What is a prefix? So, oops, sorry, I move a little something here. There we go. So what is the prefix? Prefix is found in the front. It's a descriptive word that is going to be describing the root. So it's about, we'll see more. We'll see some examples in just a minute. But the prefix comes in the front, and then, of course, the suffix comes in the back. And it's usually indicates a procedure, a condition, a disorder, a disease, the study of. It's making that word a noun, usually. But we're not going to bother about the grammar here. Let's take a look at some root words that you are going to need to be familiar with. And you'll have access to this worksheet also as an attachment in the class. So once this recording gets posted, I'll also post this as a chart, and you can print it and have it with you. So take a peek. Gastro. So these are the root words that relate. These are the root words as they relate to what part of the body. Gastro, so a gastro enterologist. Our gastro doctors, gastro relates to the stomach and to the intestines, actually. Nasal passages, right? Refers to the nose. So does rhino. Rhino refers to the nose. Op, like ophthalmologist. Sorry, this view is making me cuckoo. There we go. Thanks. Ophthalmology, the study of the eye. Pneum, this is pronounced pneum. So like pneumonia, right? Pneumonia, air, lungs. Myofascial, myofascial, muscle and fascia. Myo usually relates to muscles. Cardio, if you go and you do cardio at the gym, right? Cardio training relates to the heart, cardiovascular system. A cardiologist, heart doctor. Artho, remember this one? Relates to the joint. Osteo, relates to the bones, like osteoporosis. Nephro, did you know that one? Nephro? Nephro refers to the kidneys. So a nephrologist is actually the doctor for the kidneys. Mammo refers to the breast, like mammogram. Testosterone, that refers to the testes. And we've got glucose, glucose, glycoglucose. So glucose, glycogen and glycogen are somewhat synonymous. They just mean sugar, sugar. And then neuro, referring to the central nervous system. Neurosurgeons look for how nerve pain. So it's relating to the nerves, but it also is relating to the brain. Next slide. Here are some common prefixes. All right. So we're going to use these prefixes in a word. So a or an. So analgesic. That's so without, not, a lack of, um, anaerobic. Um, so we'll move through these, but analgesic. That analgesic is a word that means aspirin. So an analgesic cream is a cream that is designed to help with pain, to be without pain. Uh, dys, dysfunction, bad, painful, difficult. Dysrhythmia, so the disruptive, right? Abnormal rhythms. So dysrhythmia, abnormal rhythms. Why don't they just say abnormal? Because it's science and they have to sound smart. Hyper, little up. So if you have a hyperactive kid, above, excessive, beyond, hypertension, hyper blood pressure. Hyper blood pressure. Hypertension means high blood pressure. Hyper, tense in the bloodstream. Hypertension, same thing for high blood pressure. Hypo, that's below, beneath, down. Hypo. Hypothyroidism. Hypoglycemia, right? Low blood sugar. Macro, big, big picture. Macro. So remember macroeconomics, microeconomics, macro. Macro, so cephaly, macrocephaly. Yeah, microcephaly. Yeah. So an abnormally large head. Micro, tiny, small, microscope, right? Post was behind. It was after. So post-surgical, post-operative. So after the surgical operation, post-operative. Pre, in front of, prefix, before, preceding surgery, pre-operative, right? Pre-surgical. So that's prior to the surgical operation. All right, retro. Remember, if you're listening to retro music, it's it's from behind, right? From a time gone by. But retro technically means behind or in the back. So retrocardiac. So it's retrocardiac. This would be a nursing term. It would be behind the heart. Retroactive is a term that we hear sometimes. So it's retroactive. That means it applies retroactively. If you are grandfathered in, grandmothered in, then it's retroactive. Your license is good retroactive in behind, from before, from an earlier time. All right, these are very common prefixes. Ready to see a little suffixes? All right, let's do some suffixes. All right. So these are going to be a little bit different. We're going to start with the word. So celiac, relating to the abdomen. So celiac. So celiac disease, the intolerance of gluten, celiac disease, relating to the abdomen. So we've got I, see, al, us, tick. These are all common suffixes that are pertaining. It's related to. So not every IC, not every AC, not every AL is going to be about the abdomen. Our example is celiac. So celi and related to celi. So we're separating the CELI from the AC. Common one, IST. So like dentist, artist. It's a person. So ENT, ER, IST. The dentist, denti, dental. The dentist related to the teeth and gums. So ism, it's a theory typically, or a religion, or a condition. Ism. So dimorphism, condition of anatomical malformation. Let's think of a different word there. Ism. Hinduism, Catholicism. It's a theory. It's a category. Hypothyroidism. It's a condition. Be careful about the words we use with clients. I'll speak to that now. We'll just pause here on the suffixes. So the words that we use with clients are very important. They tend to take them on like a badge. Whatever you say, because of the power differential, doing a little professional practice here, because of the power differential, once you are a licensed healthcare provider, licensed healthcare professional, licensed massage therapist, there is a power differential between you and your client. And some clients will see you as an authority because you know the body. You know all this medical terminology, right? So just be careful about the words we use with clients because they really tend to own them. So if we jokingly say, oh, you are a mess, guess what? They're a mess. They now believe they're a mess. I, with my clients, use positive frames of reference. And I'd encourage you to consider the same. So those positive frames of reference. Yeah, there was a lot to work on, but your body responded really well. So if there's feedback to be given, please include a positive picture with that comment. Yeah, your hamstrings were quite tight. But you know what? They responded really well. Yeah. So that's cool. So again, when we, and hypothyroidism triggered that in my mind because we don't know what condition a client has. They may say, I think I have, or my doctor diagnosed me. Fair enough. But even something as simple as PTSD, so post-traumatic stress disorder, the language is shifting because a disorder, right? DIS or DYS, dysfunction, disorder, out of order, is a powerful label for some people. And so rather shift from PTSD to PTSI. This is actually shifting in the world of psychology. No longer are we seeing as much PTSD as we're looking at PTSI, or two different categories. I stands for injury. An injury is something that people can recover from. So PTSI, then that tells the patient they can recover from this injury versus having a disorder which could last a lifetime. See what I'm saying? So just be very careful with your words when you're talking to clients. Certainly acknowledge, yes, we did a lot of work on your low back. and it responded really well. So match that feedback with painting a positive picture. Because our clients really do sometimes take on the words you say. Again, it comes back to that power differential, right? So just be careful. Ectomy, removal of. So tonsillectomy, a surgery that removes the tonsils. Hysterectomy, or removes the female organs. You get it, ectomy. Plasty, surgical repair. So rhinoplasty. So that is a repair of of the actual nasal passages, or a surgery or repair of the nose, right? A rhinoplasty. Plasty. Itis. This is when you know itis. Inflammation, right? Pancreatitis. Um, Arthritis. Bursitis. These are all itis words. ITIS input indicates that there is inflammation. Ologist, one who studies a um, particular disease, a particular subject matter, a specialist. Yeah. So a cardiologist, right? Cardiologist. So one who studies cardio, one who studies the heart. Ology. So this is usually the study of. If it's an ology, so oncology, biology, um, those ologies. It's the study of biologies is the study of bio, of life. Oncology, actually the study of tumors, usually related to cancer. Oma, is a tumor typically. Melanoma. We do need to know again whether that tumor is benign or malignant. Benign meaning non-life threatening. Malignant meaning life threatening. We'll talk about that more with pathology. But oma, so melanoma, that is skin relating. Actually, that's a tumor of melanin forming cells. So melanin is found in the skin. A little dark, right? Pathy, a disease. Or so angioplasty is a disease of the blood vessels. Angioplasty. Not that you know the word angio, but pathy. Yeah, it's a disease in process. And then scopy, endoscopy, and it says scopy, but it's pronounced endoscopy. And also, look, if you mispronounce a word, who cares? There's all sorts. If you want to learn how to pronounce a word, you can just Google it and say how to pronounce endoscopy, and there'll be a little button, and you can listen to it. So, just know that it's going to be normal in learning a new language that you're going to mispronounce some words. It's fine, not that big a deal. But let's learn how to say it properly if we can, especially if we're going to be dealing a lot with oncology, patients. It'd be good to know how to pronounce those terms. But, it's part of learning. All right, let's see what we have next. We are going to go right into dissecting questions. We've got a bunch of questions today. All right, let's get this looking good. Let me take a quick look at the chat. All right. Vanessa, I'll address your question about the practice tests at the end. Ology, exactly, ENT. Good. All right, let's move into our questions. What are the key parts? Before we do this, let me just mention, we did just prefixes, roots, and suffixes today. There are a lot of healthcare terminology. And before we go into our questions, I want to share with you this medical cheat sheet. So this is one of the links that you'll have in the comments here below, in the description. But take a look at this. So this is from an awesome site called the MBLEx Guide. This guy really has his act together. But take a look. As I was preparing this, it was almost impossible, or it would have taken many, many hours to review these 300 words. Just take a look here. This is medical terminology. And this is, so you can see words like the abdomen, abdominal massage, abduction, accessory muscles, accommodation, AC joint, actin. Now, do you need to memorize all of these? No, it's almost impossible, right? However, it's good to just be familiar with them. And that's why I'm going to put this link in the description of the class so that if you want to just review these, you can. And some of these we don't talk about in this class. So ART, active release technique, activities of daily living. These are all just in alphabetical order. They're not obviously related to each other. But these are terms that you may have heard in school, and you just maybe not. Acupressure versus acupuncture, acute, adhesions, agonist, Alexander technique. Oh, anatomical position, ama, Japanese massage, the agonist and then the antagonist, the appendicular skeleton, applied kinesiology, aquatic massage, normally called watsu. It's the most common, but there is hydrotherapy, hydromassage, articulation. This is just the A's, you guys. Yeah. So putting together healthcare terminology that was comprehensive seemed like we couldn't accomplish that in an hour. So I wanted to show you this site. The autonomic nervous system, atrophy. So these are words that to be familiar with, not as far as reciting a memorized, memorizing all these terms, but just to be familiar. Yeah. Let's continue on since we've got A through F here. Beating is a type of percussive treatment, a type of tapotement. There's beating, there's pounding, there's pummeling. I put on pincement, there's pinching. That was a part of tapotement. I haven't seen that word since school. Best practices. Biomechanical dysfunction. What a great way to practice our prefixes and suffixes. Biomechanical. So what's the root of the word there? Mechanical. Biomechanical dysfunction, so lack of function, an imbalance in the musculoskeletal system. Yeah, biomechanical, so mechanical, how we walk, how we run, how we move in our body. Biomechanics, the study of movement and structure of the body, of a living organism or of the body. Body cavity, body work, boundaries. So if you have English as a second language, or even if you have English as a first language, this is a very beneficial list here of terms that I feel is very comprehensive. And we're only going to do A through F. So brachial. And we'll do this for the next couple minutes if it's that much longer. Breath work. An alternative type of body work. For the MBLEx, you will need to know some of the alternate bodywork modalities. Some of those we covered last week in a class. Carrier oil. Again, terms to be familiar with. These are massage and bodywork related. A carrier oil is one that you put the aromatherapy into. It carries the, it's jojoba, coconut, safflower, grapeseed. It's a carrier oil that'll absorb the aromatherapy. Being centered. That's what we did before we started class. Cerebral spinal fluid. Cerebral spinal fluid is essential to it's the core intention of craniosacral therapy. Cervicals, chakras, channels are sometimes called sometimes they're called channels. Mostly they're called meridians. So a channel, you can think of it like a river, right? A river runs through a channel, but they're usually called meridians. Chief complaint, chronic. A lot of these you already know, right? I know. Good job. Circumduction, condition, confidentiality, connective tissue massage. Connective tissue is usually referring to the fascia. Consent, we have different types of consent, just like we have different kinds of boundaries. We have verbal consent, we have written consent, implied consent, expressed consent. Contract and relax, contracture, contract, right? Shorten. Contract and relax, contracture. Speaking to a more permanent situation or an abnormal shortening of the soft tissues. Contraindications for massage. Contralateral. So contralateral, it's actually on the opposite side of the body. Cramp, crepitus. Remember crepitus from school? Cryokinetics, cryo. So usually ice, cryotherapy, right? Cryokinetics, cold therapy. And just a couple more here. Deep tissue, delayed onset muscle soreness. Good. Just again, good terms to be familiar with. Deviation. So it's a side to side movement. It can also be side to side. Sometimes this is called adduction and abduction. Get into anatomical position though. But this is right here an ulnar deviation as well. Good. Diagnose, something we don't do. Diet usually refers to what a person is taking in. What is in your diet? Not the verb that's losing weight. Or I'm on a diet. It's the food and drink that you eat. Good. We'll do just till the end of D here. Dorsiflexion, draping. And then again. So you get the idea of the scope of the words that you'll want to become familiar with. All right, let's do our questions. What are key parts? What are the key parts? Let me just move this out of the way so you can see the question. There we go. What are the key parts, of understanding healthcare terminology? A, the root, the prefix, and the suffix. B, sounding it out. C, pronouncing the word correctly to other healthcare professionals. D, beginning, middle, and end of the word. So, what are the key parts of understanding healthcare terminology? Well, we talked about that, sounding it out. That doesn't always mean that you understand it. You might be able to say it, but oh, let's check the chat. Very good. Yes. All right. Tanya, yes. Queenie, yes. Oh, Jessica, yes. Ms. V, yep. You got it. Marina, yep. Valencia, yes. Anastasia, yes. Amy, yes. Lana, yes. Good. Aite, yes. Mayor, got it. Billy K, you're in. Good. Vanessa, yes. So, key parts is being able to take a look at the root, the prefix, and the suffix. We're going to have a few practice words like that. So, the root of the word, the prefix, the one that comes before it, and the suffix. Do all medical terms have a prefix? Let's see. Answers in the chat. Do all medical terms have a prefix? A, yes, no. B, no. C, all cardiovascular terms have a prefix. Hmm. Good. Yes, Jessica. Good, Ms. V. You're on it, Amy. Yep. Good. I got a Zoom user. I'm not sure who that is. Uh, good. Good. Eliza, yes. Tanya, yes. Tiff, yes. Vanessa, good. Lana, yes. Marina, yes. Winnie, you got it. Rico, got it. Yep. Aite, yep. All right. So let's eliminate one wrong answer. All cardiovascular terms do not have a prefix. Some do, some don't. All right. Best answer? You guys got it. Letter B. Yeah. Not all medical terms have a prefix. They always have a root, because that's the word. And then a lot of them have suffixes. But in this question, I only have 3 possible answers. Why do you think that is? The MBLEx has started to shift. Depending on your state, you will either get a test with questions that have both 4 multiple choice and 3 multiple choice questions. Most recently, this week, that's what we've been hearing, 4 and 3 mixed up. They are moving towards only having 3 answers. Yes. So some of the questions on your MBLEx will only have 3 answers. Yes. Next question. What does subcutaneous mean? Over the fingernail, B, under the fingernail, C, under the skin, D, over the skin. So this is a word that we can identify the prefix and the root word, right? And this is a word you may be familiar with. So when we identify the prefix, what do you think the prefix is? Once you identify the prefix, you'll know it's not over the fingernail, right? Good. Oh, we got a lot of answers here in the chat. Let's take a look. Ooh, be careful. Be careful. All right, good. Aite, you got it. Yep, yep. Zoom, yep. Yes, the prefix is sub. What does a sub do? Where does a sub go? Where does a submarine go? Over the sea or under the sea? Good. Ah, there you go, Billy K. Yes. Good. Excellent. Good. Best answer? Oh, I best answer is letter C. It should be bolded and it should be green. So subcutaneous. Subcutaneous. Sub meaning under, cutaneous meaning skin. So under the skin. So sorry, my fault. My bad. So letter C is the correct answer. The bicep muscle the bicep has how many muscle heads? Again, look at the prefix of that word. What is the prefix? How many heads does the bicep has how many heads? A, 4, B, 3, C, 2, D, 1. Liza, yes. Ms. V, what letter? Uh-huh. Good. Jessica, good. Latrice, good. Hi. Rico, you got it. Yep. Lana, good. Yes, Tiffany. Yes, Dwayne. Yes, good. Good, Aite. Marina, yep. Anastasia, yep, sure does. Billy K. But look at the prefix, right? That's how we know. Good. Yes, Billy K. Yes, Miss V, good. Yes. So let's eliminate one wrong answer. We know it doesn't have 4 heads. That would be our quad, right? 4 sides in a quad. Bifocals, how many lenses in bifocals? Bi. Best answer, C, 2. But the bicep, right? 2 heads, bicep. Quad, 4. Quadriceps, 4, right? So why aren't the hamstrings called try something? Well, we got the tricep, right? So the tricep has 3 heads. So good. Good. Can you believe you're doing this? You're dissecting a word. Nice. What is the condition hyperglycemia? All right, take a good look at it. Hyperglycemia. A, too much gypsum in the system. B, too many gyros in the system. C, too much glucose in the system. D, too little glucose in the system. All right, hyperglycemia. Ooh, we got answers rolling in. Let's get rid of the one we know isn't right, which is too many gyros. I was trying to think of words with GY. And let's take a look. Ooh, good. Amy, yes. Vanessa, good. Ooh, careful. Careful. Dwayne, you got it. Yep. Liza, yep. Tiffany, good. Billy K, and Ms. V, good. Latrice, yep. Valencia, yep. I keep wanting to put an N in your name. Valicia. There we go. Good. Anastasia, you got it. Yep. Aite, good. Oh, good. I'm glad you caught yourself. Kusi. Um, and Marina, yep, you got it. Arbaris, yes. Jessica, you got it. Yeah. All right. Best answer? Letter C. Good. Too much glucose in the system, right? Hyper, glycemia, glycogen, glucose, glycogen, too much sugar. So in the system. Good job. Okay. See if you can do this. What kind of doctor is a nephrologist? Nephrologist. All right. A, nose. B, kidney. C, heart. Remember, pulling this word apart. What's the root? This one doesn't have a prefix, right? It has a root. Okay. Oh, got lots of answers. I'm not even gonna let's get rid of one because we know it's not heart, right? Because that's a cardiologist. So this is a nephronologist. What do we got? Ooh, Jessica, you got it. Yeah, Liza, yeah. All right, Amy, good. Ooh, swing and a miss, Billy K. Dwayne, yeah. Ooh, Ms. V, come on now. All right, Rico, yes. Vanessa, think twice. Good, Mayor, good. Yep. Tiffany, good. Nice. All right, yes, Latrice, you got it. Anastasia, yes. Winnie, yes. Arbaris, yes. Best answer. Boom. Letter B, kidney. I know it kind of sounds like nose, right? Nephrologist, but it's not. Remember rhino or nasal? Yeah, nephrologist is actually a kidney doctor. That is a wrap for today. Woohoo! And so, healthcare terminology adds to your professionalism and gives you confidence as far as understanding what actually lab reports, prescriptions, different conditions, even in reading. It can give you a better understanding and therefore give you more confidence. Let's jump to this view. Very good. Just want to say thanks so much for being here. Thanks for studying today. Great work. I'm going to hang out for a little while longer with the students who are live in class with me, answer any questions that they may have. But for you listening later, thanks again so much for being here. My name is Jodi Scholes. I'm your instructor for the MBLEx review course. We'll see you again real soon.